My name is Dr. Mark Colvin. Today I'm going to be speaking to you about quite a common disease called stroke. Our brains are very, very delicate organs. The brain needs a constant supply of blood with lots of oxygen within it. A stroke occurs when the blood flow decreases to the brain. This can be either because of a bleed into the brain tissue or a clot in a vessel leading to the brain. What happens is an area of the brain actually dies. Now, the severity of the stroke varies from minor to severe depending on how much the brain is damaged. So there may be no symptoms at all, or there may be weakness of a hand or an arm, or slurring of speech, or numbness of the body parts, or it can be as bad as paralysis of the whole one side of the body. It really depends on which part of the brain has been damaged and how much. So what is the long-term outcome of someone who's had a stroke? Well, the good news is that there's always some improvement over time. It depends on the severity again and how much the brain was damaged. But if it's not fatal and you don't recover fully immediately, it sometimes leaves long-term disability, and that has impacts on you as an individual and on people's family. And while we do have drugs to treat the after effects of stroke, the truth is that they're not usually very effective. How common is stroke in our country? Well, it's one of the major causes of death and disability around the world and within South Africa. It's true that it's more common in older people, but it can occur at any age. It's believed that in South Africa, about 60 people a day die of strokes. And stroke, together with heart disease, is estimated to cost South Africa more than 8 billion rand a year. Because of our lack of ability to really treat stroke once it's happened, our emphasis has to be on prevention. Our workplace program will help identify which employees have the risk factors for stroke, who has high blood pressure, diabetes, high cholesterol. Smoking and diet are also important risk factors. In fact, it's believed that up to 80% of all strokes could be prevented if people adopted healthy habits. So if you stop smoking, eat a healthy diet, control high blood pressure if you have it, all these things can lead to a reduced risk of having a stroke. And something as simple as taking half an aspirin a day is also very effective at reducing risk of stroke. So strokes are fairly common and they can be fatal. But the good news is that you can definitely reduce your risk as an individual by screening for risk factors and improving your lifestyle.